Hi everyone, it's Chantel again. Today we're just going to kind of go over a brief summary of what we've done this week in class. And this week we've actually focused on the eShift. So we've been talking about e-health outside of acute care settings. So we know that there's a lot of more long-term care and home health nursing opportunities now. So we see a lot of the care being shifted from a hospital or acute care setting, sending them home. So because we don't have beds available or because people are not sick enough to be staying in those beds, they're being sent home and being treated from home instead of having to stay in a bed for 2 or 3 months. They can go and be at home in the comfort of their own home and still receive the care that they need for their health there. Um, so this week in informatics, what we kind of talked about is how this links into our practice as nurses. So we know that there's going to be a lot more jobs in the field of community and public health due to this shift in needs-based care for the elderly, especially at home, but also for the everyday individual person, as the hospitals don't want to be keeping everyone in acute care settings, so in the hospital or at the doctor's office and that sort of stuff. They want to be promoting that home health care. Now, how does that affect us as nurses? For everyone who doesn't know, RN general salary for about an hourly wage is around $40. So for some families, that is expensive when they do have to cover the cost of the health care for their loved ones or for a family member. So what the eShift really is it's a different framework and frame of reference for the whole home health care plan. So basically, first of all, this technology links PSWs, who are personal support workers, to a nurse who is in a centralized location. So in this sort of setting, the nurse takes on a more administrative or manager type role. So for the mental health network, the MHEN, it basically helps to reduce hospital visits and improve the recovery time. And we talked about this a lot in class, especially with the class facilitation that we saw this week. And I think the group did a really good job of presenting this sort of information because this eShift is something that is really, really interesting. We talked about having the accessibility to your doctor or your nurse or your general practitioner at the touch of your fingertips. So can you text them? Can you call them? And that is something that I think is kind of an ethical dilemma, because as your care provider, do I want you to be able to contact me all the time? Do I want to have my own home family life? That is something that's definitely very important to be considered on the health providers side. But then on the healthcare providers side, we also have to think about, what does this mean if we're changing the roles of nurses? So with this PSW and nurse collaborative team, basically you would have a nurse in a centralized location and you would have some sort of iPad, BlackBerry, iPhone, you name it. So some sort of smart technology that would connect your PSW with your nurse. And the RN would take the managerial role. And the reason that they would use PSWs to actually go out into the community is because they are not as expensive. So really they're about maybe half the cost, so around $20 an hour or a little bit less depending on the jobs that they're going to be performing and stuff. The biggest, I think, ethical question for us as nurses now that we need to advocate for is, what does this mean for our job? Does this mean our job is being phased out? And I think one of the big things we talked about in class this week during our debate and discussion was, does this change our scope of practice? And I think it definitely does. So the way that I see it, the PSW shift is great for a lot of things. And we kind of had a debate where we were broken off into groups this week and discussed why this could be beneficial or it could hinder the care that we provide. And we all took on a role of a specific organization. My group, we actually won the debate this week, and we were playing the role of one of the medical boards. So we were trying to advocate for this eShift because we thought it would help increase jobs for PSWs. So sometimes that can be a hard job to find a vacant position for. So definitely increasing the number of jobs for PSWs increases the training for people who can deal with these sort of problems. So, in the past, it's only been RNs who have been able to go out into the community and do this sort of stuff, or even RPNs if we're really lucky, if they have that extra training, depending on how stable the patient is. But now PSWs would be able to do that sort of stuff as well. So we have more people kind of trained as a baseline, as a lot of the population gets older, and as a lot of the population will be needing home care instead of being kept in an acute care setting. The other thing is keeping those beds open in acute care settings for the people who really need them. So, I mean, you're going to have really sick people who cannot be kept at home, or who don't need palliative care, who can go home and have that. You're going to have a lot of people who are really in emergent situations, and that is something that we need to keep those beds open for in emerge and simply in the hospital, because if there's no beds to transfer someone from emerge up to, then there is no way that you're going to be able to get everyone out of emerge and help people who are really in an emergent situation. So how is this technology actually used, I guess, in the situation? A lot of the time you'll have an iPad or some sort of thing that it collects your information. So you're, as a PSW or whatever, you go out into the community, collect the information on your iPad or your iPhone, and then the nurse automatically has access to that. So if they see something that seems out of the ordinary for them, it will bring up a red flag, and it's like almost the nurse is there with you. My biggest concern with this is the scope of practice of nurses is really that one-on-one care, and I know that's why I'm in nursing as opposed to being a doctor, or I'm working as a PSW now, but as my end goal, I do want to be a nurse because you have more of that one-on-one care. Nurses are known for that advocacy and that caring aspect, and I think that's what our profession is. To me, that's what the profession really means, and to take that aspect away, I think, is a really big mistake on a lot of people's part, because that's what the profession really means to a lot of people, and people are not going to want to be continuing to do their jobs if that's not the way it is anymore. Also, the other thing is a big thing we've learned, I know, through our clinical skills is the importance of observation. So how is a nurse going to observe necessarily a patient's condition or change in status, whether that be mental, cognitive, physical, you name it, if they are not actually physically with the patient? So that definitely brings up a few alarms in my head, just because I know that PSWs are not necessarily trained to do all of these things. So just a little food for thought for you guys. We'll be posting a reflection for this e-blog, and you guys can read that over and tell me if you kind of agree with my overall thoughts. Have a great day, guys. See you later.